Good afternoon, everybody, and welcome back to our weekly COVID-19 briefing, media briefing with County Executive Marc Elrich, with Dr. Travis Gayles, our health officer, y también, I spoke some Spanish, my brain's going Spanish right now, and Dr. Earl Stoddard, who is the director of our Office of Emergency Management and Homeland Security. Of course, this week, Dr. Gilberto A, PIO, and Community Engagement for the Board of Election is also joining us. I am Lorna Virgili, Hispanic Public Information Officer for Montgomery County Government. And for members of the media, this briefing is for you today. Remember to ask for permission to record on the chat and later on to use the chat as well to ask your questions. And with that, to you, Mr. County Executive.
Hello, everybody, and thank you for joining us again. Too bad we just can't order lunch and eat at our desks and have a little casual go around here. But I'll get to the start of this. We'll talk about case information. I think it's obvious that there's an uptick. There's an uptick in the entire country. This is not good. If you look at the numbers and where we're going, whether it's in the state of Maryland or whether it's elsewhere in the country, we're not headed in a good direction. We are at levels of virus that if this had been May or June and we were making decisions about to open, we would not open. We got below these thresholds before we made decisions to open things up again. So we're not looking at it at what was only a few short months ago considered to be a not good place to be. Our case count today is 124. Yesterday it was 157. Monday was 134 and Sunday was 163. And there's no doubt that this is not an anomaly anymore. Our positivity rate is 3%, using the way the state calculates positivity. And our cases per 100,000 are up to 11.9, which is a significant increase from what it was a week ago when it was 10.4. And it's the highest number we've experienced since June 15th. June 15th. If you look at our dashboards, you look at these cases across time, you can see that, we had gotten our cases per 100,000 down near 6. And now we're approaching almost twice what our cases were per 100,000. I want to remind people that the only way we can impact these numbers right now is by wearing a mask, maintaining a physical distance, and continuing to wash your hands regularly. But I want to emphasize something that, is, I guess, the latest news. It's not like last week's news. It's maybe 2 weeks ago's news that came out of CDC, which is the issue of aerosols and the fact that the virus stays in the air for longer than we thought. That 6 feet is no longer sufficient because the virus obviously is moving around on air currents, which means it's ever more important to avoid large social gatherings, particularly in confined spaces. If you're all going to be in the same space together and you're going to be there for a couple of hours, it is not sufficient to just say, well, I wore a mask and I stayed 6 feet away from everybody. People really need to think about this. And as we go into the holiday season, we're asking people to think about different ways to celebrate the holidays. I won't be doing the family stuff that I usually do with my family. There's no doubt that we're not going to be where we need to be to say that's a safe thing to do. And so, we've made accommodations. My son just came here, and he spent 4 days in quarantine before he could take a test. Fortunately, the test was negative, but all this is difficult. And I get it. I see it personally. I talk to, friends and neighbors. People talk to me randomly about this. I know how hard this is, but until there are actual treatments that are readily available and a vaccine, which is widely available, we're going to have to deal with this in the best way we can. And the only way we can deal with this is through our own actions. So I continue to encourage people to do the right thing, even if you're tired of it. I guarantee you, if you get COVID, you'll get more tired of that more quickly than you're going to get tired of this. and the consequences can be far worse than losing a little bit of sociability for a period of time. Last week, this county tested over 6,000 people in the county program. Our numbers are very high for the county as a whole, and we continue to test strongly. We continue to insist, or we don't insist, but ask people to get tested. Because this is something that you don't know whether or not you have it, it's important to be tested. If you've done anything that involves contact with other people, social gatherings, you have all the more reason to get tested. You don't want to be bringing this back into your household or to other people that you come in contact with. So please get your tests. Montgomery County is not one of the jurisdictions that limits you to one test. So if you wanted, if you need to get more than one test and you feel like you should be tested every week because of the nature of your contacts and nature of your work, the work you do, or whatever, you should do that because we want you to be healthy and we want you to be safe. Please go to our website. We've got all the testing locations and the testing times up there. This is our best way right now for controlling the spread of the virus. So please go on our website and schedule an appointment, and you'll find the selection of both county sites and private sites. Some sites don't require appointments, and some sites do. So pick a site and go out and get tested. Some of the other big news in the universe, the election is a week away, less than a week, and we are getting prepared for that. It is amazing how many people have voted by mail or at the early voting sites in the last few days. We may well wind up with record turnout, or at least better numbers than we've had in recent years. So that's a good thing. And again, we encourage people, if you haven't already returned your ballots, get them in. And if you're going to drop them off, which I did myself, I dropped mine off at Silver Spring. I had gotten the mail-in ballot and I just went to the box outside the polling place and slipped it into the box. There was no line. It took 2 seconds. So if you've got a ballot and wondering how to get it in, that's one way to make sure you get it in and it gets there early. Otherwise, best times are right after early in the morning. It starts with a line and then the lines tend to go down. But please come in and get voted. Early voting centers will be open until the day before the election, I think. Dr. Stoddard can correct me if I'm wrong. I forget whether they close on the 2nd or the 1st, and then the election will happen, the rest of the election. Also want to let people know that we're going to have Dr. Gilberto Zelaya from the Board of Elections here to talk to us about voting and address any questions you may have. The county made its FEMA submission. This was our largest FEMA submission. We've requested a little over $31 million in reimbursement from FEMA, and we're working on yet another submission. This submission covers operating costs of the Department of General Services, March 1st through August 31st. And they generally fall into 2 categories: materials, primarily personal protective equipment and cleaning supplies, and contract labor, which included costs of enhanced cleaning under the county's existing contract, as well as additional contract costs for deep cleaning vendors. The county continues to have a very strong supply of personal protective equipment. Again, this is something that I made sure that we did at the beginning of this. I did not want us buying personal protective equipment, particularly in a market where the demand is high. So we kept buying, and we've got a decent supply on hand. And same with cleaning supplies. And Dr. Stoddard can go more into detail about our submission. Halloween's coming up. As we approach the Halloween, or Dia de los Muertos in Montgomery County, I strongly urge everybody to think about the safety of themselves, their family, and friends. And just as we adapted with graduations and birthday celebrations, we need to adapt with Halloween and try to avoid trick-or-treating, as well as finding different ways to celebrate the day. This is just one more of those inconveniences that we're going to have to put up with for the sake of public safety. but I encourage people not to trick or treat and not to do the things that you would normally do on Halloween with groups of people. We've asked people to focus on online parties and contests, decorating, car parades, and Halloween movie nights. There's guidance on our website in the COVID-19 section. It's hard to believe this has been with us now for 8 months. It's like probably the longest 8 months of anything I've ever experienced. I've never known anything that dragged on like this. And I continue to believe that if we had acted quicker and if we had acted more thoroughly, we would not be in this mess today. The route of minimizing closures and delaying everything as long as possible, along with not providing support to businesses and individuals so they could withstand closure, force people to do things that you would not normally want people to do. We've been put in this, I think, is a horrible dilemma of do we increase the risk to human life, or do we increase the risk of business failures? We shouldn't be in this dilemma. We didn't have to be in this dilemma, but we're in this dilemma, and we are continuing to do everything we can to manage it and to minimize the amount of damage that's done to our community. Certainly tested our tolerance, and we really had to redefine many aspects of our lives. I've gotten used to a more oriental greeting and putting my hands together and bowing, and maybe that's a perfectly good greeting going into the future, but there are other ways of doing things, and we need to think about what are the long-term consequences of this. So I'll just say, hang in there. Take care of your friends, take care of your family, comfort each other, remind each other that this will come to an end, or it'll certainly change to something that'll be more manageable. I don't anticipate it's going to be like this forever. But even with the vaccine, the virus will still be around, just like we take flu vaccines and there's still the flu virus around, but it will not be as prevalent and should not be as prevalent if people get vaccinated, and there will be treatments. And so there's some reasons to think that sometime in the future, this is not going to be the emotional, financial, and physical disaster that it is today. But we need to get ourselves to that future, and that's what we're trying to do in the county. And I encourage everybody to do their part. It's a difficult time, but I know we can do it, and we will get through this together. One last announcement. Tonight, we hold the last of our virtual Citizens Advisory Board capital improvement programs. We go over the capital budget choices we have to make for the coming budget, and you can get the details on our website. And with all of that, I'll turn this over to Dr. Gayles.
Good afternoon and happy Wednesday, everyone. I hope that you and your families are continuing to stay safe. Just a couple of points to highlight in addition to the county executive's remarks. He clearly mentioned that we are seeing the data trend in a way that we don't like. And we had hoped that these would be a couple of anomalous days, but unfortunately, we are seeing trends that suggest that our numbers are increasing, not only on a local level, but also regionally, as well as at the state. And so in terms of, as you know, last week we repackaged our data dashboard to hopefully make it more easily readable and digestible for folks at home. And in those measures that we've put out, when you're following that, you can see that our cases per 100,000 have increased a fair amount over the last month. And in particular, today we have our highest cases per 100,000 numbers since mid-June. And that number is troubling because we have seen, again, continued days where we're having multiple days reporting cases over 100. I do want to take the opportunity to quickly make a statement. So some of the questions that we've received in terms of feedback about the metrics say, well, how is it possible that one of the measures shows high risk of transmission and another one shows a lower risk? And the lower risk one, when looking at the three primary indicators, cases per 100,000, which sits at high risk, and our R naught, which actually is over 1, is in that high risk of transmission concerning area as well. Our test positivity has stayed fairly stable. It has been below 3 this morning. The 7-day average is actually at 3. And we know the test positivity number is based upon numerator and denominator. And our denominator, as the county executive mentioned, is the number of tests. And we have been testing more people. In fact, our testing levels across the county, including the county apparatus, are reaching suppressive levels in terms of based upon the number of folks getting tested in our population. So that number has stayed lower, but it is concerning that there has been a slight uptick in that overall number, and we've seen an uptick in the test positivity number for older residents, as we talked about last week. And again, that's concerning because we know, based upon what we've seen in the pandemic so far, our older residents, and then actually not only just older thinking above 60, we're looking at above 40 as well, are more likely to have adverse outcomes related to COVID, including increased hospitalizations and increased fatalities. And so that's why you see the numbers in different contexts and why one may show up as having a lower risk versus a higher risk in another category. So we continue to follow those trends, but certainly the trends have been established that we are seeing a sustained increase in cases, which gives us pause and gives us an opportunity to reflect on the possibility of needing to implement tighter restrictions on some of our activities. I'll be clear and remind folks of what we talked about last week in terms of the approaches that we would recommend taking as a first line. And those types of approaches would not include closure of any businesses unless there's clear evidence from a contact tracing perspective that points to a particular venue, activity, or source as causing an increase in cases. And right now, as a reminder, when we look at our contact tracing data, we continue to see information suggesting that employment outside of the home, indoor spaces, social gatherings, family gatherings, houses of worship and indoor dining facilities, those types of things have shown up more frequently in contact tracing investigations and interviews of those who have tested positive. So as part of that, again, I want folks at home to understand that we're continuing to look at the data and we are concerned. And I think that the first step in all of this is, one, acknowledging that numbers are increasing. I think that's a big step because not everyone does, but the numbers do demonstrate locally, again, regionally, as well as on a state level, that there's area of concern. Now, I also want to make sure as we move forward through the holiday period that folks keep these things in mind as you think about making plans to spend time with your family. Think about if you have family that will potentially be traveling, think about where they're traveling from or where you would be traveling to in terms of areas that are deemed to be hotspots based upon the number of cases in those particular areas. Also, it's important, and we'll most likely put out some more specific guidance, but also think about utilizing testing strategies as well as quarantining before you're coming into contact with your loved ones and family members to minimize, so one, that you would know your status, and again, minimize any potential risk of transmission when you're in those spaces. And as a reminder, even when you're interacting with family members now or members of your network who don't live within your household, that you don't come into regular contact with, it's important to not let down your guard. And it's important to continue to adhere to the public health guidance around face coverings, physical distancing, etc. The last thing I want to mention and open up for questions after the presentations is that we continue to be at a precarious point where those in the field of science and those in the field of public health are being questioned and attacked in different ways. And I would just say, the folks in the public health world and all the scientists are working really hard, from those working on vaccines to doing enforcement to make sure that businesses and people are adhering to guidelines across the spectrum. People are putting themselves at risk and working diligently to come up with strategies to keep our residents safe. And I know it's been a long haul, as the county executive mentioned, but we continue to ask for your patience and ask for your adherence to all of the different advice that we put out, because our motivation is to keep you safe. And that's all I have to say at this point, but happy to answer any questions that you all may have. Thank you.
Okay, Dr. Stoddard.
Good afternoon. Thanks for coming back. Just a few things to add to the points that have been made already. And I just want to start by reiterating one point that Dr. Gayles talked about, as well as county executive. We have increased our testing. In the context of increased testing, you would expect our test positivity number to go down. If anything, it's gone up slightly. And so in spite of the increased testing, we're finding not just more cases, but also seeing an increase in positivity, which is not the trend direction you would either expect from increased testing, but it's also further evidence of the fact that we are seeing an increase or a surge in cases. I believe the state is seeing an increase in hospitalizations. The governor referenced that in a tweet a few minutes ago, about an hour ago, I guess. And so that's something that they're monitoring. We're paying a lot of attention to that as well. We had a meeting with the governor's staff last Thursday to talk about surge in our hospital system and how the system should be ready for a surge of flu and COVID over the coming months, and where our bed counts are and what things we need to do to make sure that we have as much capacity as possible. We've got ventilators that the county has purchased, and we're going to work with the hospitals to get those, tested and trained on. And so obviously, contextually, there's a lot of work going on behind the scenes. That's a reflection of the fact that we're seeing increased cases, and there is increased national concern and local concern about what that means. But I think, as Dr. Gayles alluded to, having the conversation about the increases and what those will mean over the coming months is really, really important for us all. On our FEMA submission, I just want to give a few additional details. And so the submission that we sent in on Saturday morning totaled a little over $31 million. It was comprised of approximately $28 million in personal protective equipment that we purchased since the beginning, since basically March. A little over $2 million in supplies, mostly cleaning supplies and other, digital thermometers and other related equipment. And then about a little under 1.2 million of contract support for cleaning of our county facilities, both an increase in our general cleaning requirements, but also the sort of on-demand cleaning services that we utilize when we have a known or suspected case in a county facility. We'll typically close the facility for a day or so, clean the space thoroughly to make sure that there's no risk to other county employees, as well as to members of the public who may come in and do business in that space as well. And so those are the costs that we've submitted through thus far. We are currently working on 2 additional submissions that are running. We're working on them in parallel. One will be an additional operating costs for other county agencies, including things like bulk food purchases and other things that we've distributed, as well as some of our testing and contact tracing costs. And the other will be focused on some of the personnel costs that we've had incurred as a county. Our timeline for those is roughly that we're hoping by around November, somewhere between November 15th and November 21st, the second and third week of November, we're looking to submit the other operating costs. And certainly by the end of November, we're looking to submit a huge chunk of our personnel costs. We anticipate that those combined next two would be somewhere in the area of $70 million, but we will update that as we have additional costs available from the collection that we're doing right now. So that's all I wanted to touch on this afternoon. And with that, I'll turn it back over to Lorna.
Thank you, Dr. Stoddard. Dr. Gilberto Zelaya, do you have some opening words, or are you just going to wait for the Q&A?
Good afternoon.
Okay.
Good afternoon. My name is Gilberto Zelaya from the Montgomery County Board of Elections. So it's an exciting time, also exhausting, but we're here to serve. Nonetheless, I'm going to give you guys some brief updates and numbers. As you all know, on day one of early voting, over 24,000 Montgomery County voters voted during early voting. Yesterday's total was over 22,000, and the cumulative total between day one and day two is 46,963. So I want to applaud our civic-minded voters for showing up. Highly recommend voting over the next 48 hours. Why? We want to mitigate lines during the weekend, also on the last day of early voting, and especially on election day. Right now, the wait times are under 10 minutes, so it'll take you longer to walk from your car into the polling room. So I really highly recommend taking advantage of this fact between today and tomorrow, which will help our election judges process more voters during the weekend and on election day. From those, we're going to go to mail-in ballots. So the State Board of Elections, and we have processed, and the State Board of Elections has mailed over 377,000 mail-in ballots to Montgomery County voters. We at the office have received and processed over 252,000 mail-in ballots. When I say received, we have scanned, batched, confirmed that the return envelope has a signature. And once we scanned in the evening, the State Board of Elections will upload the received status onto your voter record. Now, by all means, please, received means that it's in our possession. It's secure, it's safe. We are in the process of flipping received to accepted. Keep in mind, we are implementing early voting. We are coordinating election day deliverables. We are canvassing hundreds of thousands of ballots. We are tending to thousands of calls, and a lot of them are about the received to accepted status. So we ask of your patience so we could focus on the voters voting in person while we service the voters that have voted via mail. So by all means. So out of the 252,000 received scanned in ballots, and when I say scanned, I'm talking about the scanning that we scanned into MD voters, not scanning into the scanning equipment to be tabulated or counted. So we have canvassed over 160,000 mailed in, scanned as received ballots. Out of those 160,000, we have scanned or tabulated into our high velocity scanners over 80.
Dr. Z has frozen, I believe.
This is very dramatic.
80,000 ballots. So
There he
flip
is.
those records from received to, and that's 40,000. Okay, so when you break it down, please, unfortunately, we are limited by physical distancing. We're trying our best to not only serve our in-person voters, but also serve the anxieties of our voters who submitted their mail-in ballots. So patience. From those individuals, we are curing 76 mail-in ballots without signatures. We are curing them. We have contacted the voters and we have coordinated with them so they could come to the Board of Elections so they could sign their mail-in envelopes so we could incorporate into the canvas. And out of the 252 scanned ballots to be introduced in canvas, we have only rejected 5. The reject percentage in Montgomery County is 0.0097. Once again, 0.00197. So I appreciate our civic-minded voters for following the instructions. Once again, if you have your mail-in ballot, send it to us as soon as possible. Use a black ballpoint pen, sign the voter oath on the return envelope. And if you're voting in person, don't forget to download our app, our MoCo voter app. It gives you the closest early voting locations, wait times, and also if you text the letters EV and your zip code, EV and your zip code to 77788, it will give you the closest early voting location and wait times. And if you text the word box, BOX, and your zip code, it will give you the closest ballot drop box in Montgomery County. And in Spanish, the word is buzón and your zip code. And in English for early voting is VA for votación anticipada and your zip code. So please use the tools and the MoCo voter app in Spanish, but your language setting must be in Spanish. So use the tools available, vote safely, and try to take advantage of early voting today and tomorrow to mitigate lines over the weekend and on election day.
Thank you, Dr. Zelaya, for that presentation. And with that, we're going to open it for the questions. Reporters, remember to ask for permission to ask the questions. And the first one is from Aisha from Fox 5 DC for Dr. Gayles. Can we unmute Aisha? We having trouble unmuting her?
Okay, I think I'm here. Am I here?
Yes,
All
you
right.
are. Yes.
All right. Well, I've got two questions, and I'll be quick about them. This is for Dr. Gayles. First question I want to ask is about the metrics just released by MCPS last night for return to hybrid learning. So basically, from what the chart way it explains it is that we would need to be, less than 5 cases per 100,000 for most students to be allowed back into school or for hybrid learning. But it sounds like, that will not happen for some time, or it's unlikely this year, or even, until we have a vaccine. So some may think that this is more restrictive than the CDC, the state, and CHOP guidelines. So Dr. Gayles, I want to know what your take is on that. And the second part of that question, and I can repeat it again if you happen to forget, about the increased number of tests that you just talked about, could that be the reason why we're seeing the rise in cases?
Well, good afternoon, and thank you for your question. So, I would like to actually applaud our colleagues at MCPS. I know they have received a lot of flack. They have worked very hard to come up with reopening strategies and plans. They've been working on those plans and strategies since the spring, since we were seeing our higher numbers. So they have been working through and getting guidance from us and other sources to be able to formulate and come up with their plan. Their plan that they released is not terribly inconsistent with similar plans that have been released by other jurisdictions in Maryland, including Anne Arundel County and Howard County. And when you look at the cases per 100,000 number, in terms of that, it actually does follow some of the guidelines from the state in terms of there being a requirement of a test positivity below 5% in cases in different categories of cases below 5 per 100,000 being the requirement for, opening up full in-person instruction, and then there being this larger gap between 5 and 15. And so when you also look at the guidance that was provided from the CDC also breaks it down. They break it actually into more restrictive categories in terms of 5 groups, in terms of those numbers, and not just, below 5 to 15 and greater than 15. They actually have more specific criteria that helps inform that decision. So I would just also add that these are very difficult, tough decisions when you're basing them upon surveillance data. I know that the guidance that we helped provide to them was informed by looking at a host of other states, not just the Pennsylvania guidance, looking at the school reopening plans from Oregon, Washington, California, the state of Massachusetts, and a number of other places. So kudos to them for coming up and developing a plan that is based upon evidence-based practices and best practices from other areas. And the challenge will be, again, because we've always said repeatedly that the effectiveness of any reopening plan is really contingent upon seeing demonstrated lower rates of community transmission. And the hope is that not just for MCPS, but looking across the state and across the country, that we will be able to achieve those numbers so that kids can go back safely. Now, on the second component in your question related to testing. So as Dr. Stoddard actually, you mentioned in his comments, so you test more people, you do have the risk of finding more cases, particularly those that are asymptomatic. But I think it's important to highlight that we were testing at comparable levels back in June and early July, and we weren't finding this many cases. We were seeing our test positivity drop significantly to, I think we even had some days where it was below 2. The averages were always somewhere between 2 to 3. But even in those settings where we were testing record numbers of folks, where we were seeing 5,000 to 6,000 tests being resulted, we were not seeing, in most of those days, we were not seeing 150 to 160 cases reported. So test positivity is one measure. And yes, if you test more people, you do run the risk, not risk, but the reality is you could find more cases. But cases are cases. And when you're seeing numbers increase from, again, to go back to July, where we were seeing, I think we had a day where we saw 30 some in the low 30s in terms of cases reported on a daily basis, to now where we're starting to see 120, 150, 130 on any given day. It is suggestive that the numbers are increasing regardless of how many folks we're testing.
Thank you, Dr. Gayles. Rebecca Tan from the Washington Post has a question for Dr. Zelaya.
Thank you. Dr. Zelaya, I think you cut out for me just as you were saying how many ballots have been tabulated. I'm wondering if you could just repeat that number, and then I do have another question for you.
Yes, so tabulated, we have scanned or tabulated over 80,000 ballots.
Got it. And I appreciate you walking us through sort of the process in which ballots come in, particularly mail-in ballots. I'm wondering, there's a lot of concern about this nationally. Do you think that the local board of elections will be able to count a majority or a significant amount of the votes on election night itself? Will we have a sense of how Montgomery County voted on, various issues on the night itself, or is it going to take until Wednesday, Thursday?
We still got 5 days. We're scanning as much as possible. We're doing our best and we're doing our due diligence. That's the $1 million question. So by all means, on November 3rd, once all votes have closed in the state of Maryland, we will release the early voting results. We will release up to as many scanned mail-in ballots, and we will release election day results. But for the press that are here present, to 30 to 40 minutes before those results are released, because our teams must come back to the Board of Elections. So it's going to be a long night. Patience is a virtue. Be kind to us, and we will do our best with results. But I could assure you that we will need to scan continuously as soon as possible.
Dr. Zelaya,
We don't have
yeah.
a date. I don't have a date.
Okay. Dr.
Yeah, but
Zelaya,
we don't have a date as per se. Yeah.
we are having some audio problems from your end, Dr. Zelaya, and you were kind of breaking. Rebecca, did you get your question answered, or would
Yeah,
you like
I think so. I think I got it. Sorry.
You're good to
Thank
go?
Yeah.
Okay.
It's also important to note that in the state of Maryland, there will be no results released at all until the final voter in the state has voted. So for example, if there is a voter in line in a precinct in Anne Arundel or Baltimore City or county or somewhere around the state who is waiting in line and is in line at the time that normally the polling places would close, that voter will be allowed to vote, and the results anywhere in the state will not be released until that voter has voted.
Got it. Thank you.
Okay. Kate Ryan with WTOP
Correct.
has questions for Dr. Gayles and Dr. Zelaya. Kate?
There we go. A quick question for you, Dr. Zelaya, and I appreciate you, trying to reassure people on the process. Again, I want to make sure, because of the connection problems, 80 to 82,000 ballots have already been processed and tabulated. Is that correct?
Yes, over 80,000. Correct.
Okay. Now, there are some folks who have concerns because, as you've said, they're anxious. They're like, wait, I can't tell what's going on with my ballot, who are saying, I think I should go in and vote provisionally. What do you say to those voters?
Simple. Please don't. If you have submitted your mail-in ballot and you have received a notification that it's been received, you are good to go. You're causing lines to be longer and slowing down the process for voters who still need to vote in person. So out of the over 250,000 voters have received the received status notification, you're good to go. Let us do our part and we will process, tabulate, scan, and canvass your ballot as soon as possible.
Terrific, thank you. Dr. Stoddard and I'm sorry, and Dr. Gayles, because I listened to your briefing yesterday and you talked a little bit about Thanksgiving. Dr. Stoddard, I think you said on Thanksgiving, it's a high risk activity. I'm gonna have to take my mask off. I wanna be close to my family at the table. At what point do you think you'll give the kind of guidance that will be very concrete in telling people definitely get tested before you think about it, do or do not travel? When can we expect some, you know, cut and dried, if you will, measures?
I would think that we're gonna wait till right after Halloween so as not to confuse the messaging. And so obviously we'll get through this weekend, and I think next week we'll be talking a lot more about Halloween, or Thanksgiving specific guidelines. But just to circle to what you've said, that, you know, we talked about this with the county council yesterday. It is a high risk activity. Unlike many Halloween activities are outdoors. Many of them are more transient, or it's short-lived in terms of interactions. Thanksgiving obviously is a whole different sort of situation. It's family from all across the country, internationally in some cases, coming together around a table to eat a meal that tends to be extended. A lot of hugging, a lot of long people haven't seen each other. And so I think the clear message is we know that people are going to do it, and we are not going to be able to discourage people from seeing their families on Thanksgiving in many cases. So while we're not recommending it, we are going to recommend you know, some mitigating things that you can do to keep it safer than it would be otherwise. And obviously, I think our big concern is what happens after Thanksgiving, and what kind of, you know, we're seeing an upward trend now. What kind of potential explosion do we see after Thanksgiving from all the people traveling around the country, coming into communities or from communities where the case rate is much higher than it is in Montgomery County? What kind of introduction do we see there? And so I think that's sort of where we're at. But we're hoping to have some more concrete, specific guidelines next week about how to develop a family plan, how you can do like your own mini bubble. We've seen some of the sports leagues be very successful with the bubbling, and we're going to break it down so that it's very easy for people to understand how to develop a plan that allows you to do that for your family. Terrific.
Dr. Stoddard, or Dr. Gayles, rather.
I don't have anything to add on that. I think the question's been
okay.
covered.
And a brief follow-up. You mentioned the possible, and you've said this repeatedly, possible need to roll back, particularly those 10 p.m. to midnight alcohol sales. We're at 11.9 per 100,000. Does that tip us in that direction? How close are we to seeing a rollback there?
Well, I think what I can say from a health perspective, we're continuing to look at the numbers and provide guidance to the county executive and the county council as Board of Health. I think we're at an important point right now. I think that it has been clearly demonstrated that this is not an anomaly where we've had a couple of bad days in terms of numbers. We are seeing sustained patterns, and I think it's important to, again, not only acknowledge that, I think it's also important to consider putting in strategies that could include, you know, curtailing programs that are in place right now, as well as additional steps and you know, potentially around capacity limits and those types of things that would offer opportunities to arrest a further increase and hopefully bring numbers back down that would prevent us as a local jurisdiction and as well as a region and as a state from seeing our numbers increase to a significant level where larger scale closures would have to happen. So if you're asking when is the time to be concerned? Yesterday. I think we're all concerned, and we've all been talking and discussing not only locally, their conversations at a regional level, and, you know, continuing to have conversations with our colleagues and peers, particularly our other health officers in other jurisdictions across the state who are recognizing the same trends and are concerned about the direction of the data.
Thank you, Dr. Gayles. Just a reminder to participants, this briefing questions are for members of the media. Next is Donna St. George with the Washington Post with questions for Dr. Gayles and also for the county executive.
Hi, thanks for taking my question. I wanted to ask you both, the state superintendent of schools this week called on Montgomery County and several other counties to reopen for some level of in-person learning or small group learning. She said from her perspective, the metrics were there and it was time to reopen. Do you consider this safe, and what do you see as the path ahead from a kind of health metrics and safety standpoint? Thank you.
So I'll say, thank you, Donna, for the question. I'll say this from the public health perspective. We have been provided the opportunity to provide guidance to our local and our local public and non-public schools based upon our local metrics. It was brought on earlier in the pandemic that local jurisdictions would have the opportunity to make those decisions that were relevant and germane to their jurisdictions based upon where the epidemiologic data was there. And we continue to do that. And we've continued to provide that guidance to our local schools, again, both non-public as well as public. And that has sometimes been in the absence of guidance from the state. And we have continued to use the guidance from the state that has criteria set at a test positivity below 5% and case rates somewhere between 5 and 15. Given that broad range, we've also looked at other places, including the CDC guidance that has broken down those categories into more specific buckets in terms of providing more specific guidance to risk of transmission. And we've also, again, looked at other states. So, in response to the superintendent, thank you for the input. We will continue to provide guidance that builds on the state as well as other experts in other areas who demonstrated best practices to apply that guidance to our schools. Now, non-public schools have been open in some capacity, and the public school system has put out a plan. They put it out yesterday that talks about their provisions and parameters within which they would bring back school students. And I know that even though a plan was formally submitted yesterday, that they have been working on plans and strategies to bring back students in different capacities, whether they're small groups or focusing on specific special populations, if you will, that we know would benefit more greatly from in-person learning, recognizing the challenges of distance learning and virtual learning in those spaces. I do think it's also important to note that we have seen some public schools in the state of Maryland, unfortunately Dorchester County, who actually closed their schools earlier this week and the end of last week, based upon an increase in cases, based upon the metrics that were put forward by the State Department of Education. So we will continue to be in constant communication with our colleagues in other areas across the state. We will continue to use the information that has been provided by the state, but we will also look at other areas for best practices, as well as further expertise to guide those decisions and guidance that we provide.
Do you consider it safe? Is that sort of?
I will say this, I think also recognizing we do have ongoing litigation that limits my ability to answer some of these questions. I will say this, we have provided and informed in the guidance that we've provided to the public schools and non-public schools as best as we can. We have tried to come up with numbers and surveillance data that helps inform those processes. So I think that's the best way I can answer that question, given the parameters within which I can answer. And I think the other thing too is to emphasize that, community transmission is what drives all of this. And so when we're looking at the parameters put forward by the state and the parameters put forward by different areas, it's based upon community transmission levels. And in fact, looking at the state, even though we have had a test positivity below 5, our cases per 100,000 have been larger, and we have not met the criteria to go back to full in-person instruction. And, I know the school systems continue to work on their plan, and I think that moving forward, there'll be lots more conversations about it. And I know that they've worked really hard, as well as many of the non-public schools, to come up with safety plans to put in place in their buildings to help mitigate transmission as much as possible.
I would only also note that the CDC guidelines, particularly as it relates to the case rate that they utilize, their case rates calculated for the CDC guidelines at a slightly different level. It's actually over a 14-day period as opposed to a daily rate. It is the breakdown that the CDC uses is more risk averse than the state's categorizations, meaning the state's categories go up to 15 cases per 100,000. That would actually be viewed as a moderate risk level by the CDC. And so, actually that would be viewed as a higher risk by the CDC. And so there's some conflicting material that's out there for schools to reference. And so, we've given them sort of the guidance. I think that's what they utilize to develop some of the things that were released yesterday. But the schools, not just the public schools, the non-public schools are in a very difficult position now where they've got sort of different guidelines that are being issued by the state and by the CDC that they have to try and navigate essentially by themselves because our local ability to be prescriptive has been taken away by the governor's executive order. And so they're sort of on their own to make their own decision, which is the freedom, I guess, is good for some, but it also leaves them in a lurch when the question of when they should roll back some of their activities is a really challenging one because now they're having to make that decision essentially by themselves.
Okay, we have about a couple of minutes left because the county executive wanted to add something.
Yeah, I support what Dr. Stoddard and Dr. Gayles said, but to be blunt, these numbers would not have led to an opening. It wouldn't have happened. It didn't happen. So how numbers that were once considered not safe to open suddenly become safe to do things is a little bit beyond me. And particularly the cases per 100,000. There was a time when, the recommendation was any cases above, was it 10 per 100,000, was considered heavy transmission. Half the counties in this state are in heavy transmission mode. Montgomery County is in heavy transmission mode. Prince George's County, I think all of the major counties are either at 10, I don't mean major in terms of importance, just size. They're either at 10 or they're in the 9s. So, and they're all heading toward 10. So how they think this is safe is just beyond me. Now we're working, and Dr. Stoddard talked about this. We are really trying to figure out what would it take to make a room safe. What do you have to do to break down the viral loads? But until we can tell somebody that if you do this, then you're not going to have to deal with the indoor air quality and the presence of virus in that environment. It's hard to say, just go ahead and do things. So I think, I understand the frustration. I understand the desire to get back to school. I was a school teacher. I fully understand what an amazing challenge this has to be to do this, but the risk of putting people at risk of becoming sick again. And, I hear from people, it's like, oh, kids don't get sick. Don't worry about it. Kids may not get that sick. They spread it and they spread it to adults. And if they spread it to adults, you're not going to see the problem in the kids, but you're going to see it someplace else. I think it's short-sighted. And what I really wish the state would do is work with us on trying to identify the science and then providing the funds to make places safe to open, as opposed to just changing your data perspective and saying it's safe to open. I don't doubt that we couldn't get to a safe place, but that would actually require some work and some planning and some additional science. And I would love for them to partner with us in getting there.
Okay, I believe some of the panelists have to jump to another meeting. Do we have time for one more question, Mr. County Executive? There are a couple more here. Okay, so Jack Moore from WTOP has questions for Dr. Gayles and for you, Mr. County Executive. Jack, very quickly, because they really need to go.
Yeah, so I received a press release this morning from Rockville-based Advogenics, blast from the past there. They said they have been cleared to perform coronavirus testing again. I know the county has already canceled the contract. Just curious, as the county looks to expand testing, would the county consider working with Advogenics again? And have there been any conversations since the lab has been given the all clear?
We did have a conversation to hear about some of their opportunities in terms of the different services that they provide. At this time, based upon our current needs, we have capacity, but similar to, as we've consistent with what we've always said, we continue to explore new partnerships, and particularly if there are new opportunities for new technology to integrate into the systems that we have. And so that's where we currently stand with Advogenics, as well as with other companies that could potentially be able to meet those needs as they arise in the future.
All righty,
Dr.
thank
Gil-
you. Uh-huh.
Sure, Dr. Gilles, you did mention just earlier, I just wondered if I could, you know, the attacks on public health professionals. And I know that was something that, you know, had been a particular personal issue with you. And I just wondered if there was anything new that you wanted to share today, or if, you know, kind of what prompted those comments.
Well, it's not anything for me personally. It's just, you know, kind of the broader assault on science in terms of, you know, there's been recent, and it, you know, for example, I've heard this argument that physicians are trying to overdiagnose folks with COVID because somehow we get paid more money, or doctors get paid more money, or when we're looking at how, you know, death certificates are certified, causes of death, that, you know, we're overinflating, you know, COVID when it's, you know, someone has another underlying condition. You know, there's just multiple attacks on the field of science and evidence-based practices, which completely undermines our ability to effectively communicate with our residents and help them understand what's safe and what's not safe, and putting in practices to mitigate transmission. We know that COVID is still very much alive. I, you know, read something yesterday that has suggested that November 4th, you won't hear about COVID. I can attest to you as a public health official, we will still be talking about COVID-19 because we will still see people getting cases. We will still see people being hospitalized, and unfortunately, we will still see people dying. And so to the folks in Montgomery County, I can attest to you that we as public health officials will continue to work well beyond next Wednesday to further policies, further activities, and further preventative tools to keep you safe, because that's our job and that's our priority right now.
All righty, thank you, everybody. I hate to cut this very quickly, but the county executive has to go to another broadcast that's starting right now. Thank you, everybody, for joining us, and we'll see you again next week. Take care.